they always say, love what you do and you'll never work a day in your life, because work will feel like something you're enjoying, which is what I do. So try to do something that you enjoy, or else you will be miserable, and ensure that you do the necessary research to know not just the the business aspects of it, but also every little dealings that you will have to do with people and things like that. So you have to go in with a plan. Don't just jump into something because you see someone else is doing it. Do something that you know about, and I would always say invest in yourself. I'm Dr. Steve Baul. I own a dental clinic. The name is Dr. Steve Baul and Associates. Dentistry was a choice for me where I was thinking about doing medicine or dentistry. However, I was told that there are a lot of medical doctors and there is a higher need for dental operators, because our country only had 40 dentists when I graduated for the entire country. So I think I'm doing more to help the country being a dentist rather than a medical professional. I've been in dentistry. I graduated 6 years ago. I've been in the public system as well as the private system. I've practiced dentistry in every single region in Guyana, but now I'm in strictly the private sector, and I'm very, very comfortable doing most types of dentistry, and I've done a lot of courses from local to overseas, and it prepared me to be able to do the latest in dentistry for my patients. Here at my clinic, we try to make everything about the patient. Even the treatment plan, I would always go through it with the patient and make sure that we come up with something that suits what they need, as well as their budget as well. So what we try to do is put the patient first, and like the slogan says, your smile is our passion. We care, we're passionate about what we do, and this usually evolves into us being very good with all of our patients. In addition to that, we always do follow-ups. We show that we care, because we actually do. And I think once you care about what you're doing, you will do it to the best of your ability. And that will ensure that the service we provide here would be top-notch. We offer all types of general dentistry, including fillings, root canals, cleanings, routine examinations, surgical extractions, and we'll be doing braces from now as well. We are a registered clinic with registered practitioners and everything. I know traditionally you have what you call the quacks who do work, but I think Guyana on a whole, we're trying to gravitate away from that. So what I'm finding is that we're having more and more dental clinics opening, which is good for dentistry in Guyana. So you don't have people having to resort to having quacks work on them and doing, you know, incorrect procedures, and which might actually affect their health. I've had a lot of instances where I actually had to correct things done by people who were not trained, and definitely I would advise people as well, when you're going to do dental work or any work for that matter, make sure that the person you're going to is registered. You can ask them to produce the certificates that are behind me. Some patients might only have a bit of crowding or a bit of spacing in their teeth, and they want to focus on that. So what we do is we try to fix it as fast as possible using a patented fast braces technology, and it works really well. Sometimes it can be finished in as little as 6 months, and it's geared towards patient satisfaction. Like I said, you wouldn't find a case where you might have someone in patients for years just because the dentist wants everything to be perfect. You understand? Because at the end of it, patients do not want to be in braces for 2, 3, 4 years, right? They want to get it over with, and it's also better for the patient as well, because when you have braces on, it makes it a little more difficult for you to clean your teeth. So you don't want a case where, oh, your teeth are perfectly straight, you take off the braces, and then your teeth are shaking, or you have a lot of cavities because you couldn't have cleaned your teeth properly while you had the braces on. So it's something, it's out of America, and it's something that I've been doing, and it works really well. So I usually try to introduce at least one new service every year. That way we know that we're going forward. Braces would be the last thing that we introduced, but my colleague, my associate, he's actually getting trained in doing implants. So that's a service we will be looking at in the future as well. And another thing is we do flexible dentures, but it's done abroad. So what we're trying to do is to get the facilities locally so that the patient doesn't have to wait 3 to 5 weeks. They can get it done maybe in a few days, which would make it really convenient, not just for the clinic, but for the patients as well. I know people don't want to walk around with any missing teeth, right? Even though they have masks now, at least they know that when they smile, they need to have some teeth to smile with. And what I'm trying to do as well is to establish more branches of Dr. Steve Baul and Associates. We're actually building a brand, you know, and also I'm trying to get a lot more dentists and have them properly trained and working for me in the future as well. This will allow us to spread a little bit further rather than just the East Coast. We might go on the East Bank, maybe over the river, maybe even in Essequibo. So the possibilities are endless. The response has been excellent for the few months that we've been open, and I'm definitely looking forward to expanding in the future. In terms of the equipment, I try to buy mostly either German made or American made, and because in dentistry you want your stuff to last for as long as possible. The materials that we use are some of the best offered in dentistry. We use, for fillings, we use 3M, and everyone knows 3M is one of the best names worldwide. So we would use things that would last the patient for a very long time. And also my equipment, I try to use things that would make things easier for me. So I would have, you know, digital x-ray sensors, things like that, just to ensure that, you know, it makes my work more comfortable. And the only time I get stressed out in dentistry is when I have things that are not working properly. So as long as everything works well, I find that it's easy to work with. First thing I do when I wake up is look at my baby, and that just puts me in a good mood for the rest of the day, because if she's awake she would just start smiling, and that usually just gets me up for the day. I would get ready and check my appointments, and then I would see what my day would be like. I would see what treatment people might be coming to do. So I would just wrap my head around what I might do for that day. And then I would come to work and work on my patients. We usually try not to get so much patients at the same time because of COVID. Plus, I don't want to keep people waiting for too long. So in most cases, you would just find one patient here we work on at a time, which makes me able to put all my efforts into that one patient and don't worry about having to hurry it up to look at another patient. So that would be my day. I would get my work done. I would deal with staff and see if there are any things that we have to do for the clinic. I try to go home every lunchtime, not just for lunch, but to play with the baby, of course. Because a lot of times I would be at work and then my wife would send me a picture or a video of something she's doing. So she's kind of like my fuel. I would be tired, I would go home, and then I would get a new burst of energy to come back to work. I try to not work too much because you find that sometimes you get drained, and usually when you get drained, you don't like what you do anymore. So that's why we actually close two days a week, Thursdays and Sundays, just to get our batteries reloaded. And I don't want to overwork my staff neither. They work very well, so I want to make sure that they get enough rest so that they can produce some proper work. Ideally, I would prefer that she follows in my footsteps. I know my wife would as well. She's a pharmacist, well, she's going to be a pharmacist soon. But she said she would prefer if Riley does dentistry. So I would definitely, as soon as she's able to walk, I would bring her and put some forceps in her hand and get her accustomed to the system, because I would be ecstatic if she can actually take over for me. And so definitely I would try to. That's what you usually find in dentistry though. In law and dentistry, you always find that the children follow in the footsteps of the parents. I was at this dental outreach right in Berbice, and it was with the Save Abby Foundation, and I had a patient who was 3 years old. It was a good experience. I was surprised that this 3-year-old child was so comfortable that unfortunately he had to do an extraction. That was the only thing that we could have done for him. But he actually sat through it. He was the perfect patient. In terms of bad experiences, a lot of times it involves children as well because they're not easy to work on. So on this very same day, there was I think he was about 6 years old, but he was biting and fighting and everything. So you can have good experiences with the same people that you might have bad experiences out as well. I worked 3 years with the public system, then I was private and I was working for people, and then I ended up opening this clinic. This was one of the most difficult things I've ever done in my life, not just the financial aspect, but the actual work of turning nothing into something. It has been a very long journey, and just knowing everything that I've been through, it was quite challenging, but at the end of the day, I think it's worth it. You can't have something good without paying your dues. So at this point in time, I basically did everything that I could to reach to this point. I was in the public system, I worked for people, I ran a clinic, and then the only step forward was for me to open my own clinic. And I actually took a while to make sure I had the experience so that when I actually opened the clinic, I would be able to do everything and I would be able to provide, the best service. I actually always say treat your staff well and they'll be your greatest asset. I always try to make sure that my staff get along with each other as well as me. Sometimes I can be a bit strict, but it just means that, it's everyone that can take correction. Even me, sometimes I get corrected and I don't have a problem with it, which is a big deal for me that people could learn. So staff are very, very important. They're actually one of the best things about whatever business you have. So I try to treat them well, and we have a very good relationship actually. A lot of the patients that I work on are friends from before, or sometimes even family. And even after I work on a lot of patients, so I can't remember every single patient, but I usually would see them out somewhere and they would recognize me and I would recognize them as well. And I've actually made friends from working on patients as well, because a lot of times, there's a certain trust that the patient would have to gain for them to allow you to work on them. So in terms of being able to work on a patient, you're already forming somewhat of a bond with that person, and you can end up being friends with patients afterwards. I've had cases where I've been out and I've seen some patients, and they usually come and hang with me and things like that. So my main associate is my colleague and my very good friend, Dr. Budai. He has a clinic in Borbis actually called Smile Designers, but every 2 weeks he comes up here. So right now it's me and him, but I'm looking into getting some other associates on board. I've been approached by some of the younger dentists and they're actually promising, so I might consider taking on 1 or 2 more of them. To a new dentist, I usually work with them as well. Some of them do, they come and do part-time work here. But what I would ask them to do is be patient. It's not, when you graduate, you know the basics. It's going to be a long journey and you never stop learning. I always do courses almost weekly, and every single day in dentistry something gets invented and you find a different way to do something. So you will never stop learning, and that's the only way that you can provide proper service to people, is that you stay one step of everyone else by making sure that you know what's the latest in dentistry. The moment you're stagnant, you don't even stay in the same place, you go backwards. So if you're not going forward in dentistry, you're literally, I think, going backwards, because the things that you know today might not be applicable even a year from now. So definitely be patient, learn as much as you can, not just about dentistry, but dealing with people as well. One of the most important things that you can do is be empathic to your patients. So I think that part of dentistry, don't overlook that part, because it's very, very important. I'm Dr. Steve Baul and I'm an entrepreneur.